So I overheard someone tell her mother that in one particular plan, she would save $1,000 over a different plan based on, guess what, the maximum out of pocket. Now, to me, that sounds ridiculous, but I understand that not everybody has been looking at plans for 10 years who help thousands of people over those 10 years and has a very analytical brain like mine. So, what I decided to do is make this video and tell you why exactly how this wonderful, loving, thoughtful daughter trying to help her mom, but was looking at the completely wrong stuff. So I know if you're on a high deductible health plan, the max amount of pocket responsibility is very important when making decisions on which plan to enroll in, because most likely if you're on one of those plans, if anything happened pretty much at all, you'd be looking at blowing through almost the entirety, if not the entirety, of that deductible. But on Medicare Advantage plans that are not an MSA, a Medicare savings account, which is like the equivalent of a high deductible health plan, but for Medicare, if you're not looking at those plans, then the maximum out of pocket responsibility is kind of like a safety net. It's not going to save you more money on another plan, especially if you're healthy and you're not going to be in and out of the hospital, on dialysis, or on any of those really high cost chronic medical services that are serviced by Part B typically. So that's like chemotherapy or any kind of injection where they're putting a drug into you in some kind of clinic for a very long time, like for the rest of the year, for example. So aside from that person, the way to look at plans are very simple to me. And in this video, I'm going to kind of try to give you the framework to figure it out in a simple way. All right. So number one is you have to prioritize. All right. Just like how when you decide to cook dinner, like I've probably helped more people pick Medicare plans than I've actually cooked dinner. But if you think about cooking dinner, you have to kind of build a plan. How are you going to put these ingredients together to make dinner? How much are all these things going to cost? How long is it going to take to prep? How long is it going to take to cook? And how much will it feed? So all of those things are really important when you are trying to cook dinner. Similarly, when you are building your framework for deciding on how to choose a Medicare plan, there are those simple components. So the first thing when you're building dinner, right, when you're trying to figure out what to make for dinner, you do need a recipe. Fortunately, all Medicare Advantage plans follow the same recipe, which is the summary of benefits, to kind of give you an idea of what each of those line items, the recipe items, are, right? They all have the same recipe, and each of those components of the recipe, the only difference is really the cost that you have to pay. All right. When you're looking at these plans, you also have the ingredient list. Okay. So the recipe are all the services that the plan covers, which are all the same, all have to cover medically necessary services offered by A and B. And if you need a drug plan, well, you got to pick up D as well. And you also need to know what ingredients you need. And to me, the closest simile I can pull off this outlandish analogy is doctors and drugs are like the ingredients. So you need the ingredients to start cooking. So let's go ahead and figure out what we are, of course, cooking. So who's your doctors? Or what medications do you take? Plug those in, and then from there, you can now figure out what's the next steps, right? That's the most important, not how much is the most I would ever spend on medical services when you can't even get those medical services to begin with, right? So we need to figure out first doctors and then drugs, okay? The next step in figuring all this out is the financial portion, the fun part, the stuff I love, okay? So that's on a continuum of premiums and copays. Typically, the higher the premiums are, the lower the copays will be, and vice versa. And it's not a one or none, it's usually a blend. So it's not like just because you're paying for more of a plan means that your copays will always be the lowest. There are some plans out there that are both up here, one down here, both down here, both up here, all different and all varying degrees. So how do you figure all that out? Well, after you've plugged in your doctors, your drugs on the websites that I use to make all these analysis, then I figure out what are the high cost services. Okay? Unless I have someone telling me exactly what services they need, then I'm looking at the most expensive services, which are going to be ambulance, inpatient stays, Part B drugs, MRIs, CT scans, diagnostic stuff. And usually if they need outpatient surgery, if they know something's coming, I'll look at that as well. And those are the top cost items, line items on a Medicare plan. So once you have those things kind of figured out, you can go and stress test. And how do I stress test? Well, I look for the plans with the lowest premium, right? These are 0 premium per month, or sometimes if you're lucky enough to live in an area that has a Part B give back on plans that actually have drug coverage, then you look at those plans and figure out, okay, how much are those expensive services on these plans? And if they are not much better than the expensive plan that you can buy, like the one that might be over $200 a month, then maybe consider why. Like, why is it that one plan is so much more expensive? Are you buying benefits that you don't even need? Like, is the expensive plan, does it include dental where the dental network isn't even available to you in your area? Does it offer things that you don't need? Maybe you don't need transportation and it gives you more transportation benefits. What exactly is driving that premium cost up? Is it just the copays? Are you buying extra stuff that you may or may not need, right? So that's the second part of it, the continuum of premiums and copays, and then all the extra services that you could possibly have wrapped around in the mandatory supplemental benefits of a Medicare Advantage plan. And mandatory supplemental benefits, MSBs, industry term for stuff that when you join the plan, you automatically receive. Stuff like gym membership, stuff like if the plan includes dental, they're called mandatory supplemental benefits. So that pretty much sums up the biggest components of figuring out your Medicare Advantage plan kind of things. Now, I did write a book on it. It's not that long. You can check it on the link down below. And if you want to try and get out of this whole Medicare Advantage plan system to something more simple, like a Medicare supplement plan, please do let me know. That is primarily how I help a lot of people escape the whole prior authorization network referrals nonsense that Medicare Advantage space has. Now, if you're interested in that, please do follow and subscribe for more.